This is Mike Cavnaugh with HIVHero.org and HERONEWS.org and Out Magazine. I'm here with Judy Gold. How are you?
Hi, how are you, Sally Jesse Raphael?
I'm doing fantastic. I always loved her.
I loved her too.
Okay,
But you have the similar glasses.
You know, I think color's everything.
I agree. I had green glasses on and my son told me to change.
I have a whole thing of glasses.
Yeah,
every
me
color.
too.
You got to have every color.
Why? Because people only wear one pair of glasses all the time, and it's like, no, it's like an accessory.
Exactly.
Well, we know, but the other people
I know you don't know.
Yeah.
So here we are at GMHC. Why is this organization so important to you?
Oh, Mike, I was in college in the beginning. I was in college when the AIDS crisis began, and when I moved to New York, right when I graduated in '84, I started volunteering at God's Love We Deliver and GMHC, and through the '80s, I worked at the AIDS Walk. I mean, I had so many friends who were HIV positive, and they're still here. And of course, I lost a lot of friends as well. But it's so important to keep the message out, and especially when I work, and I'll go, I travel around, I do a lot of shows, and I'll meet young gay men, and the first thing I tell them is, please wear a condom. You have no idea. We can never, ever forget. And I am so proud to be a part of this community. I mean, look what we've done. Look what we've accomplished. And it's horrible that a plague started our, us being not just gay men and lesbians, but one community.
Yeah, and GMHC does so many amazing things. They give meals every day. I go to lunch every day, and I'm so thankful for it. They do acupuncture,
it's
art therapy.
They legal help. I mean, they do everything. I mean, it's like the go-to center.
Yeah. So Judy, you're doing everything. You've been on every show. You're amazing. So what's coming up for you?
Well, you'll see me on I've been doing a lot of guest spots on TV shows, Unbreakable Kimmy Schmidt, Search Party, The Jim Gaffigan Show.
So tell me something a little that few people know about you, a little secret.
All right, I play classical piano.
You do?
Yes. That's one secret. And the other secret is, and I'm not kidding, I handwrite thank you notes if people invite me over for dinner, anything.
I love that.
That, to me, is a lost art. And that is... and my kids, when they got bar mitzvah, I'm like, you have to write thank you notes. They're like, fuck you. And these cards that they have, like, dear blank, thank you so much for the blank. No, it doesn't work, okay? An email is not as personal as a handwritten note.
I'm lucky if I got a text. These kids these days, call
these
people.
days, yeah.
Call people, write people.
Hello? God, I think of all the people, and I just want to say, please.
Yes.
Wear a condom.
Yes, our slogan is condoms are hot. Do you think condoms are hot?
I do think, I'm a lesbian, but, I always give my sons condoms.
Okay.
Well, not my 14-year-old, but my 19-year-old. Yeah, yeah.
So can you say
They're
condoms are hot?
Condoms are hot.
That's amazing. This is Mike Cavnaugh with HIVHero.org and Out Magazine. I'm here with Kelsie Louie. He's the CEO of GMHC. How are you?
I'm so excited about tonight.
It's amazing. It's a beautiful, beautiful, beautiful event. So who are you honoring tonight?
We are honoring Louis Bradbury, a visionary, Mary Fisher, an activist, and Dustin Lance Black, another activist. Really such special people to our community and to our fight against HIV and AIDS.
Well, I have to tell you, I was just saying to Judy, I love your organization. I go to lunch every day there. You're always doing more and more services. We are very honored to honor you last year at our gala.
Yes.
And I just can't tell you how much we all appreciate what you guys do. Do you have any new initiatives we should know about?
Yes, we're so excited. We did a soft launch about this announcement, and we're going to announce it again tonight, that we have decided that GMHC will be pursuing healthcare, which means that we will be able to provide medical services on site at GMHC.
That is incredible, amazing. When is that going to happen, do you think?
It's a long process, so we don't have a date, but we just know that GMHC has been a cornerstone of HIV, AIDS care and prevention and advocacy, and in order to move forward to end this epidemic, we need to offer health care.
I think that is the most amazing announcement. I'm so proud of you. I'm so proud of the organization. Please go to gmhc.org, make a huge donation, check out all their services, and just come to these events because they're unbelievably fabulous, and you get to see these amazing people, performers, and whatever. GMHC.org. Thank you so much. Congratulations on the event.
Thank
so
you.
good to see you.
Same here. Thank you.
This is Mike Cavnaugh with HIVHero.org and HERONEWS.org and Out Magazine. I'm here with Dustin. How are you?
I'm good. I'm looking at your bling. It's distracting. You're blinding me with the earring.
Oh, thank you. Yes, I try. Little, if you're not sparkling, what are you doing?
Yeah, no, I got to learn from you.
Well, listen, I am a little bit in awe standing next to you. You're kind of a hero of mine, writing the screenplay for Milk, winning the Academy Award, and I will never forget the speech you did at the Academy Awards. Really groundbreaking and amazing. So why is it so important for you to be here at GMHC?
Well, I mean, this issue is not done, and I'll talk a bit about it tonight. When I was a kid growing up in the Bay Area in theater, my mentors, the people I was training with, the directors, the designers, were vanishing. I wasn't told where they went. I just knew that they weren't back the next season. And back in that day, silence and invisibility really did equal death. And times have changed. We're now in a time where treatment could mean prevention.
Right.
But there are barriers still. The barrier used to be homophobia, now it's stigma and poverty. And we got to figure out how to use our history, use our know-how, use our voices and stories to get past the stigma and past the issues of racism and poverty that keep this a problem.
I know there's been a lot of breakthroughs now. The PrEP is here. It's a great tool, but you've got to remember that you still have to use a condom. When someone says they're negative, you can't believe them. It could be 6 months they haven't been tested, right? So,
yes.
Our slogan is condoms are hot. Do you think condoms are hot?
Yeah, well, I'm in a long-term committed relationship now, but people have to make the decisions that protect themselves and their lives. Man, these young people out there, your lives are valuable, and they can be fierce and they can be beautiful, and protect that shit. Protect it. And if that means if you're out having a good time and you don't know the person very well, you better put on a condom.
All right, that's great. So what's coming up next for you? What are you working on?
I'm doing When We Rise for ABC. It's an 8-hour miniseries on the LGBT movement from 1971 until now. And it's an incredibly diverse group of true stories of people working on the ground and in the middle of the movement, not necessarily the leaders of the movement, that formed a family that created this fast-moving movement that got us to where we are today, and it has some hints of where we still need to go tomorrow.
That's fantastic. When is that going to be airing?
That's January, February of next year.
Okay, we're going to look forward to that. And thank you so much for being a part of GMHC. It's such a great organization. Please make a huge donation at gmhc.org. Do you have a website that people can find out more about you?
I do, DustinLanceBlack.com.
Okay, we'll check him out, and we look forward to seeing much more from you in the future. Thank you so much for talking to us.
Absolutely. Nope.
I just talked to the CEO, Kelsie Louie, just said that they are going to start providing health care at GMHC, a huge announcement. What do you think about that?
That's fantastic.
Yeah.
That's really fantastic. Yeah. Is he going to announce that tonight?
He is going to announce that tonight, so we got a little bit of a scoop there. But I just want to say that I'm so proud of you, and I'm so thankful that you're always at these events. What are you up to? What's coming up for you?
I'm finishing The Good Wife, the TV show I'm in. We've got 2 more episodes to shoot. And then I'm doing actually a movie in May, just got pushed a little bit, about a man who was involved in the early days of ACT UP, and about how he's kind of obsessed with the whole AIDS epidemic. It infuses his art, and he meets this young guy, and it's about their relationship. So it's actually very pertinent to tonight. So it's called After Louie, and I'm shooting that in New York in May. That's
great. Is there any chance we're going to see you on Broadway? We miss you on Broadway.
I mean, I will be again, I'm sure, but there's nothing concrete right now.
Okay, well, I can't wait. Remember, be safe out there. Condoms are hot is our slogan. Wrap it up, be safe. Thank you so much, Alan. Thanks. Congratulations. Have a wonderful day. Thank you. This is Mike Cavnaugh. I'm here with Larry Mass, one of the founders of GMHC. How are you?
Hi, how are you?
I'm doing fantastic.
Yes.
Here we are at the gala for GMHC. How far you've come. Isn't it amazing?
It really is. I mean, when you think back, it's, 33 years, something like that, 34 years, 1982 that we became incorporated. So, geez, and we haven't changed a bit, right?
Yeah. So tell me how this all started. You guys got together and felt a need for this.
Well, the linchpin of it all was Larry Kramer, who I was writing in the gay press at the time, and I started hearing rumors about cases of pneumonia and people skin cancer, and we didn't know what was going on. And so I started to write what became the first press pieces on AIDS in the New York Native. And, Larry immediately got everybody, got the whole community going in various initiatives and endeavors and fundraising efforts of what became Gay Men's Health Crisis. It sort of began in Larry Kramer's living room, and those of us who were involved in various ways, I was a physician, I was writing in the press, we were volunteering in various ways. But don't forget, this is 1981. There was like still 3 years before we had certainty about what was causing the epidemic. In the first couple of years, we didn't even know what the cause was. So we weren't sure it was a virus or some kind of chemical problem, or we didn't know what it was. People were talking about things like biological warfare, and but finally, the likelihood from even early on was some kind of a transmissible agent. And then finally, HIV was identified in 1984. So.
Well, thank God for you and your pals for starting this, and you're helping so many people to this day. And it's amazing. I just talked to Mr. Kelsie, and he said you guys are going to provide health care starting pretty soon. I'm very excited about that.
Yeah, these are incredible developments. GMHC has continually expanded its services, and it's a very exciting development that it will finally get to direct health care.
Well, our organization is called HERO. It's HIV Experience Resources Organization. We help newly diagnosed and people living with HIV. We direct them to GMHC. But I have to say, I'm standing next to a real hero. This guy is a real hero, and I'm getting a little beclammed. Thank you so much for all that you've done and continue to do in the fight against HIV.
All that you do. Thank you so much.
My pleasure and honor to meet you.
Thank you.
This is Mike Cavnaugh with HIVHero.org and Out Magazine. I'm here with Eric Sawyer. How are you?
I'm well, thanks.
So happy that you are here. An amazing event. Why is GMHC so important to you?
Well, they were first in the fight about AIDS, and they've always provided a lot of leadership on a number of things. I'm actually here with the founder of Blood Mirror, which is it's a piece that actually contains the blood of HIV positive people, and is trying to draw attention to the fact that there's a ban against gay men donating blood in the US. That's a ban from the FDA, and his piece is trying to draw attention to the need to remove that ban, and GMHC is one of the first organizations that took up that fight.
That's amazing. That's great. Well, GMHC is an amazing organization. So happy to be here. Make a huge donation to GMHC.org, please. And we're a site for newly diagnosed people living with HIV. Do you have a message about the importance of still being safe out there?
It's really important to be safe. A lot of people are on PrEP and have undetectable viral loads and think that there's no reason to use condoms anymore. That's actually not true. There's lots of other sexually transmitted diseases that one can get, and there's even the development of a drug-resistant form of gonorrhea. And we certainly want people to be safe and not only protect themselves against HIV, but other sexually transmitted diseases, including hepatitis, which is on the rise.
Yeah, it's very true. STDs are going up, so please be safe out there. And what are you working on right now? What are your issues that you're working on?
I work for UNAIDS, the HIV programs at the United Nations, and we're right now working on a 2016 high-level meeting on HIV. That's when governments around the world come together and negotiate a new declaration of commitment on what governments and the UN system will do for the next 5 years with regard to the HIV response. So it's really important to reaffirm that governments continue to not only provide funding, but governmental commitment to fight HIV. There's no longer a Millennium Development Goal about HIV. The Sustainable Development Goals did not carry forward an HIV-specific goal, only general health goals. So we have to keep governments accountable for the HIV response.
That's great. Where can we find out about your organization and read more about this?
UNAIDS.org is the website, and look for the high-level meeting on HIV/AIDS.
That's amazing. So thank you so much for everything you do. What do you think we need to do to really kick this virus in the butt in the future?
Well, I think we really need to continue to promote testing. Unless people test and know their HIV status, they can't get on medication if they're infected. And we know that having people on HIV drugs and managing their health so they have an undetectable viral load dramatically reduces the viral pool circulating in the community, and that stops the spread of HIV. We also have to encourage people that are at high risk of HIV not only continue to use condoms, but get on PrEP if they're having difficulty using condoms every time they have sex.
And how do we get these high-risk groups to listen? I mean, what can we be doing to really reach those audiences?
Well, events like this are really important. It's important that we try to hold our political candidates who are running president accountable and get them to talk about HIV. The community has recently been circulating sign-on letters to all the candidates of both parties, trying to get them to commit to a plan to end AIDS by 2025 in the U.S. The United Nations has a plan to end AIDS by 2030, and Governor Cuomo has announced a plan to end AIDS in New York State by 2020, but we're hearing nothing about it on the campaign trail this year, and we really need to raise our voices. If you're communicating with the campaign or if you send letters to the campaign, be sure that you mention the importance of HIV and get all the candidates talking about not only the U.S. response, but the global response as well.
Yeah, this is not the time to do nothing. We're in an election year. The Senate is up for grabs. We can do a lot more, so please vote. Please call your congressman, call your senator. We need this to stop by now, but let's go for 2020 and see if we can eradicate this disease. Thank you for everything you do and all your help.
Pleasure.
Thank you for being at GMHC Gala, and have a wonderful evening.
Thank you so much, and thank you for your interest in HIV. Sure.
Thank you.
Everybody please, right here. Everybody, right here.